It's time for the KBOI Medical Moment, brought to you by Regence Blue Shield of Idaho, featuring Dr. Kenny Bramwell, the Executive Medical Director for Regence. Dr. Bramwell, good morning.
Good morning.
Dr. Bramwell, Dr. Stephen Hawking died last week. He, of course, suffering from Lou Gehrig's disease. Can you tell us a little bit about this disease?
Yeah, sure. Stephen Hawking lived with Lou Gehrig's disease, named after one of the most famous people who suffered from it, New York Yankees first baseman Lou Gehrig. The disease is also known as ALS, or amyotrophic lateral sclerosis, a progressive neurodegenerative disease affecting the nerve cells in the brain and spinal cord that make the muscles of both the upper and lower body work. These nerve cells lose their ability to initiate and control muscle movement, which ultimately leads to paralysis and death.
Dr. Bramwell, Stephen Hawking lived quite a long time with the disease, correct?
He really did. He died this past Wednesday at the age of 76, more than 50 years after being diagnosed in 1963. That was a remarkably long time for a patient who suffered from ALS. Usually, people who contract ALS don't survive that long, as people with the condition lose control of muscle movement, eventually losing their ability to speak, eat, walk, and ultimately breathe. In comparison, Lou Gehrig retired from baseball at age 36 after coming down with the disease, and he died just 2 years later.
Stephen Hawking always struck me as having a great attitude toward his condition. He certainly did not let it slow him down.
No, I don't think it slowed him down at all. He was thinking great thoughts until the end there. The disease left him paralyzed and completely dependent on others and or technology for everything. His voice certainly comes to mind. He required help for bathing, dressing, eating, moving, and speaking. He was able to only move a few fingers on one hand, but he nonetheless tried to lead as normal a life as possible, and he didn't think about his condition or regret the things it prevented him from doing.
Dr. Bramwell, the Food and Drug Administration recently announced that it plans to try to lower the amount of nicotine in cigarettes. Why this move now?
Well, the FDA would like to lower the nicotine content in cigarettes with the thought that this will make the cigarettes less addictive. The FDA believes that these less addictive cigarettes will cause fewer deaths.
What is tobacco's current impact?
Tobacco use, mainly cigarette smoking, is the leading cause of preventable death and disease in the U.S., killing about 500,000 Americans each year. About 15% of Americans still smoke.
Now, is the idea of this initiative to reduce the number of young people who smoke?
Yes. The intent is to reduce the number of young people who become addicted to cigarettes because of their high nicotine content.
Well, Dr. Bramwell, we thank you for your time this morning on KBOI.
Thank you very much, gentlemen.
Thanks, Doc.
It's the KBOI Medical Moment, brought to you by Regence Blue Shield of Idaho, featuring Dr. Kenny Bramwell, the Executive Medical Director for Regence.